Yes, we can hear you.
Okay. Okay, so good day, everyone, and welcome to this discussion on the human cost of climate change. And this is a public health perspective. My name is Eloho Obukohwo, and I am honored to be here today as a global health professional with expertise in pharmacology. I'm excited to be here to address one of the most pressing issues of our time, the impacts of climate change. And the impacts of climate change are not just, looming threats on the horizon. They are here. They are unfolding before us in real time, shaping our words in ways we cannot ignore. Intersection of climate change and health is very multifaceted, affecting everything from disease patterns and food security to displacement and strained healthcare system. So before we delve into our discussion for today, I would like to extend my deepest gratitude to the Help People Help Themselves organization and the Global Journal of Medicine and Public Health for organizing this essential event. And I also want to acknowledge SM Kadri. I hope he's here, the editor-in-chief of Global Health Journal and Public Health, for this incredible opportunity. And to everyone present here today, to all the health professionals, leaders, students, and participants joining us today, I want to also thank you for your time, your commitment, and your willingness to engage in this conversation for today. So before we delve into what we have for today, I would like to take us a little bit back to Cyclone Freddy. I don't know if we know about Cyclone Freddy that happened in 2023. It happened in Malawi, and this was one of the longest lasting tropical cyclones that is ever, recorded. And it wreaked havoc across the communities and displaced 500,000 people. And the destruction was devastating, homes washed away, livelihoods shattered. But the true catastrophe unfolded after the cyclone happened. As thousands of displaced individuals crowded, makeshift shelters, sanitation deteriorated, and the disease took hold. Cholera took hold of Malawi. And cholera is a waterborne disease that thrives in unsanitary conditions, and it spreads like wildfire. So this happened in Malawi. It spread like wildfire, infecting tens of thousands and leaving a trail of illnesses and diseases in its wake. The human suffering did not end with the storm. It did not end with the cyclone. It was compounded by the cascading effect of poor healthcare access, malnutrition, and social instability. So now I want to pose a critical question. How often do we stop to consider the connection between climate disasters and public health? Because too often we focus on only the immediate disasters, the immediate devastation, collapsed homes, the floods, the injured bodies. But what about the ripple effect? What happens? What about the outbreak of diseases, worsening malnutrition, the strained and overwhelmed healthcare system struggling to meet these surging demands? So in this webinar, we will explore these questions in depth. We'll dive into the scale of the crisis, just how many people are affected, and what the projections tell us about the future. The interconnected systems will also going to tell a story about how these systems, how they drive health risk from environmental degradation to economic instability. We're also going to look at the direct and indirect health consequences that climate change is inflicting in our world, in vulnerable populations. And we're also going to look at what actions should we take? What actions should we take, the government, healthcare professionals like us, and our communities? What actions should we take to mitigate these impacts? Because climate change is not just an environmental issue. It is a human crisis. It is shaping how we live, how we access healthcare, and ultimately how we survive. As we move through this discussion, I want to encourage you reflect on what we can do, both individually and collectively, to address these global emergencies. So I have, I've explained what climate change is all about. We now know the story of what happened in Malawi, so we can get a picture of how devastating climate change is affecting our society. And from this slide, we can see that the numbers are staggering and they paint a concerning picture of the scale of the crisis that we're facing. Right now, 3.6 billion people, nearly half of the world population, reside in areas that are highly vulnerable to the devastating effects of climate change. These individuals are not only living with immediate consequences of environmental upheaval, but also with the long-term instability that threatens our health, our livelihoods, and our future. From scorching heat waves that push our temperatures to very high level levels, to catastrophic floods that are submerging entire communities, and wildfires like what happened in California that consume homes and livelihoods. And the impact of climate change is no longer distant. It is our everyday reality now. Millions of people are already living through these disasters and experiencing firsthand the destruction that comes with altered climates. And according to the projections from WHO, the situation will only worsen if immediate action is not taken. The projection that we can see shows that from 2030 to 2050, climate change is expected to cause an additional 250,000 deaths per year due to the worsening case of malnutrition, malaria, diarrhea, heat stress. But these numbers only tell part of the story, because by 2050, the cumulative impact of climate change is anticipated to lead to an astonishing 14.5 million additional deaths globally. And this is concerning. This increasing frequency of climate-driven natural disasters is already overwhelming our hospitals, our healthcare facilities, and our emergency services are being pushed beyond their limits as communities all around the world face waves of climate-induced diseases, displacement crises, deteriorating living conditions. So our healthcare system, there's a lot of work that needs to be done, to empower our healthcare system to fight these climate-related diseases. Healthcare systems in developing nations, many of which are already under-resourced, are particularly vulnerable. And this leaves billions of people at risk of inadequate medical care when they need it the most. But we must understand that this crisis did not happen overnight. It is a result of century industrial expansion, environmental degradation, and unsustainable human activities that have fueled the rapid acceleration of climate change. To truly understand how we arrived at this moment, we must step back and look at, where does this come from? When did our climate start changing? We must examine the interconnected systems that have contributed to this escalating emergency. And this is where we look at the story of how our climate change came about. To truly grasp, how we have reached our current climate and health crisis, we will look back in time at the Holocene epoch. This was a geological period that began thousands of years ago. The Holocene was a time of climatic stability, one that allowed human civilization to flourish. The weather patterns during the Holocene period provided the foundation for agriculture, settlement, technology, progress, and the birth of complex societies. Then in regions like the savanna regions, the seasonal rains arrived with credibility, offering fertile lands and rich ecosystem. And farmers depended on these cycles to plant, to grow, and harvest crops, ensuring stable food supplies. And this balance between rainfall and dry season sustained our ecosystem, nurtured biodiversity, and supported expanding human population. Also in the temperate zones, the shift in temperature during spring and autumn detected the agricultural calendar. There was a 90-day cycle for planting, which allowed civilization to prosper. We built infrastructure and advanced our trade networks. Then there was food security. There was economic stability and population growth. Now, the natural equilibrium that sustained humanity for thousands of years have profoundly disrupted, and we're no longer living in the Holocene. According to scientists, we are now in the era called the Anthropocene epoch. And this is a period where human activity has dominated the planet. And over the past 150 years, and after the Second World War, we can see in this industrialization, deforestation, and fossil fuel consumption, which has accelerated our climate change. It has degraded our ecosystem and destabilized weather patterns. Also, we can see deforestation, once driven by agriculture and urban expansion, has led to the loss of crucial carbon sinks, forests that absorb and store green gases. And without these natural regulators, the level of carbon dioxide and methane in the atmosphere has skyrocketed, trapping heat and causing global temperatures to rise beyond the normal levels. Industrial agriculture, with its heavy reliance on chemical fertilizers, has stripped our soils of its nutrients, increasing desertification and food insecurity. And also the warming of our planet is also disrupting our ocean currents. And the Atlantic meridional overtuning circulation, AMOC, an essential component of the Earth's climate, is showing signs of weakening, devastating consequences for weather patterns, storm intensity, and regional climates. As these systems that we have are breaking down, our ozone layer, as they're breaking down, we witness more severe hurricanes, more severe natural disasters, droughts, and extreme temperature fluctuation. And the repercussions of these disruptions are far, far-reaching, and it disrupts our balance, the balance that once sustained civilization, that once provided food security, that once maintained our biodiversity, is crumbling, and rising temperature has, affected our glaciers. They've sunk our glaciers and ice caps, and these are contributing to the rising sea levels that we experience that threatens our coastal populations. The species that once thrive in specific ecosystems are now facing extinction, disrupting food chain and diminishing access to natural medicine sources. And also our water. Now we experience water scarcity, which is caused by prolonged droughts and declining river levels. And it's leaving millions of people without fresh water, without clean drinking water, which further leads to, public health crisis. And the shift from the Holocene to the Anthropocene is not just a geological change, it is a humanitarian emergency, because the consequences of human activities have set in motion a domino effect that endangers our climate, our ecosystem, our food systems, and our health. And if we fail to address these interconnected challenges, the global community will continue to face worsening health crisis, displacement, and social economic instability. The direct impacts of climate change on our health. They are evident, from the spread of infectious diseases, increased rates of heat-related diseases, declining food security, food scarcity, the rising frequency of extreme weather disasters. These are evident. And one of the pressing concerns is the rise of infectious diseases, which are rapidly expanding due to climate-related changes. As the global temperatures increases, the ecosystems are shifting, forcing humans and wildlife to live in close contact with each other. And this increase of likelihood of zoonotic diseases, illnesses spread from animals to human. For example, COVID-19, Ebola, Zika virus. In fact, there are over 100 zoonotic diseases that now spread from animals to human. The expansion of warm, humid environments has also accelerated the spread of vector-borne diseases such as malaria and dengue fever, which are now appearing in regions where they previously were rare and non-existent. Now you can see them in South America and Southern Europe. Another critical issue is the rapid melting of polar ice caps and glaciers. This ice formation, help regulate global temperatures by reflecting sunlight away from the Earth's surface. As they melt at an accelerating pace, less heat is reflected, further warming the planet in a dangerous feedback loop. The resulting rise in global temperature is leading us towards heat-related illnesses with the elderly population, young children, and individuals with pre-existing health conditions being at a greater risk. The 2023 European heat wave alone resulted in over 68,000 deaths, demonstrating the devastating impact of these unchecked temperature rise. Rising sea levels are another issue. They are another alarming consequences of climate change, leading to saltwater intrusion into freshwater supplies. And this contamination is rendering our water sources undrinkable, and they are increasing the risk of disease outbreaks in coastal communities. Coastal flooding is also another issue. Coastal flooding, which is exacerbated by stronger storms, rising water, is also displacing population, creating humanitarian crisis, food insecurity, and also increased risk of waterborne related diseases like cholera. Food insecurity is an escalating problem. As we can see from everything we've been saying, food insecurity is one of the major impacts of climate change on our health. As droughts, floods, and unpredicted weather patterns, they disrupt our agricultural system. An estimated 45 million children worldwide are currently facing malnutrition as a result of climate-induced food shortages. And malnourished individuals are at the heightened risk of diseases, developmental impairment, and also weakened immune system. When crop yield declines, there is also an increased dependence on chemical fertilizers and pesticides, or GMOs, like we call them now, which degrades our soil quality and introduce toxins into our food supply and compound health risk. Water scarcity is another critical challenge that is being intensified by climate change. Major freshwater sources are drying up, leaving the entire region without sufficient access to potable water. For example, the Yangtze River in China, which in 2022 hit a record low level due to prolonged droughts, severely affecting hydroelectric power production, irrigation, and drinking water supplies. Also, the Aral Sea, which was once the largest lake in the world, has nearly disappeared due to decades of unsustainable irrigation practices, devastating local ecosystems, and devastating economies. And also Lake Chad. I recently learned that Lake Chad is almost dried up. 90% of Lake Chad is dried up and is continuing to shrink, leading to resource conflicts and worsening humanitarian crisis. So as these rivers dry up and groundwater supplies become increasingly contaminated and outbreaks of cholera, dysentery, typhoid are on the rise, refugees and the underdeveloped regions where water access is already limited, they tend to suffer the most. So before we go further, I would like to ask these questions, and I want us to drop our answers on the chat. Which of these climate-related health impacts concern you the most? So type your answer in the chat box, what concerns you the most and why it concerns you the most. And we'll take a break. We'll look at the answers and then we'll continue with our presentation. Okay, so I can see a lot of number ones, number five, all of these infectious diseases, extreme heat, heat-related illnesses, food insecurity, malnutrition, water scarcity, contaminated drinking water, displacement and climate migration are all concerning, and they are all interrelated. Infectious diseases can also spread, like COVID-19. It's not just going to happen in one region. It will spread. It can spread even all across the world and have severe impact on our public health as well. And climate migration as well, because a lot of people are losing their homes, the entire community losing their livelihood because of the climate change in their communities. So thank you very much for participating in the poll. So we'll go further to talk about who are more vulnerable, who are the vulnerable population, vulnerable people to the effects of climate change. the harsh reality of climate change is that those who contribute the least to the crisis are often the ones who suffer the most. Across the globe, low-income communities, marginalized groups, women, children, and entire communities are bearing the brunt of climate-related devastation. These populations have limited resources to adapt, making them disproportionately vulnerable to the consequences of rising temperatures, environmental degradation, and extreme weather events. Low-income countries, yes, despite contributing less than 10% to the global greenhouse gas emissions, are experiencing the worst effects of climate change. Let's take Bangladesh, for example. The country faces an existential threat due to rising sea levels, which has projected to displace about 13 million people by 2050. These climate refugees will be forced into overcrowded conditions where access to clean water, sanitation, healthcare is limited, creating a perfect breeding ground for infectious diseases. Women and children are among the most affected by climate change. Malnourished children are more vulnerable to infectious diseases and developmental issues. And this creates a poor cycle of health and economic hardship that is difficult to break. According to UNICEF, over 45 million children today are seriously malnourished due to climate-related food shortages. Another profound consequence of climate change is the mass displacement and migration, because as extreme weather events intensify and natural resources become scarcer and more people are being forced to leave their homes in search of safety and stability. And according to the World Bank projection, by 2050, climate change will drive the displacement of over 260 million people worldwide, making climate migration one of the most pressing humanitarian challenges of our time. An entire nation can be forced into permanent displacement. For example, the Pacific island such as the Kiribati, the Tuvalu, the Marshall Islands, they are on the front lines of rising sea levels, and these communities are they're actively planning relocation as their homes are becoming uninhabitable in the coming decades. The psychological impacts of losing one's homeland cannot be overstated. It's not just land that is lost, but identity, its heritage, its sense of belonging. Now, the impacts of climate change on our health, it puts our healthcare system under pressure. Healthcare systems all around the world are faced with this crisis due to growing threats that are posed by climate change, extreme weather events ranging from hurricanes, wildfires to flood to heat waves. They are not only increasing in frequency, but also pushed to their limits, leaving countless individuals without access to life-saving care when they need it. An example would be Hurricane Maria in 2017 that happened in Puerto Rico. The storm caused a widespread of power outages, and it rendered hospitals inoperable, causing essential medications such as insulin that needs to be cooled to spoil. And the consequences were tragic. So many unavoidable deaths happened simply because basic medical services were inaccessible in the wake of the disaster. Unfortunately, Many healthcare professionals lack the resources, the training, the infrastructure, and necessary tools to respond to emerging health threats. With overburdened hospitals, limited funding, healthcare systems are currently, struggling to keep the pace with the escalating demands of the warming world. And another example we can see is also what happened early this year in California. We can see from the fire outbreak that happened, we can see how emergency systems were overburdened. The fire department was also overburdened trying to save lives. And I think we lost about 28 persons to the fire, and over 100,000 homes were destroyed. Also, the economic impact of climate change on our health. By 2050, there's a projection that climate-related healthcare costs would exceed $1.1 trillion annually. The economic burden of, climate-induced illnesses, responding to disasters, and building medical infrastructure is rapid, escalating, and putting a serious strain on both public health and national economies. One of the major drivers of this cost is the increasing frequency of natural disasters, which not only cause, direct destruction, but also lead to long-term health crisis. Wildfires, like I earlier mentioned, that we, saw early in the year, has, contributed severely to air pollution, increasing respiratory illnesses and hospitalizations. And these fires, along with, other climate-induced disasters, are estimated to cost the economy over $10 billion annually in healthcare expenditures, loss of productivity, and also loss of infrastructure. Now, beyond the direct medical expenses, climate change is impacting our labor productivity. This stress is making it harder for workers, particularly those in agriculture and construction, to perform their jobs, leading to lost wages, reduced economic output, and a greater financial burden on public health system. The ripple effects of these economic losses, will continue to grow unless urgent action is taken to mitigate the effects of climate change. Now, what is the path forward? What can we do, to mitigate climate change impact on our health? The intersection of climate change and public health demands immediate coordination and sustained action. Tackling the crisis required a multifaceted approach that incorporates policy reforms, healthcare adaptations, community-led initiatives, and technological innovations as well. Let's talk about policy changes and government actions. Governments must prioritize environmental policies now. I think now is the time for environmental policies to be number one when it comes to addressing policies that governments make. They need to address policies that focus on reducing carbon emissions, transitioning to clean energy sources, and strengthening disaster preparedness programs. Investment in climate-resilient healthcare infrastructures, including hospitals that can withstand extreme weather events, will be essential in safeguarding our communities from future crises. Also, strengthening our healthcare system. Our healthcare system must undergo significant transformation to adapt to climate-induced health challenges. These include upgrading our hospitals and clinics to function during extreme weather events, expanding disease surveillance network to track and mitigate the emerging infectious diseases. For example, the use of tools such as the WHO EWAS tools to predict and to prevent diseases outbreak in vulnerable areas. Also, we need to enhance our medical training programs to equip our healthcare workers with the knowledge and tools to respond to climate-related illnesses effectively. I think climate change should be like a compulsory course to learn for our health professionals to learn at school how to mitigate these effects and how to work effectively even when we have extreme, climatic disasters. Community-led adaptation strategies or solutions. At the grassroots levels, local solutions are often the most effective in addressing climate-related health impacts. Sustainable agricultural practices, water conservation efforts, and improved sanitary systems can help our communities build resilience during climate shocks. And indigenous knowledge and community-driven initiatives must be supported and integrated into national climate strategies. Also, we look at scientific innovations, investment in climate resilient crops, low carbon healthcare infrastructures, and alternative energy sources will be crucial in mitigating climate change impacts on public health. So finally, we're going to, call ourselves to action. This is a call to actions for us health professionals because the debate is over. We know that climate change is a threat on our planet. We don't have a planet B. So, and climate change is a public health emergency currently, and urgent action is required as global citizens, policymakers, health professionals, community leaders. We all have a role to play in mitigating the effects of climate change on our health. Addressing climate change isn't just about protecting our environment. It's about safeguarding human lives. It's about preventing unnecessary suffering and ensuring a healthier, a more resilient future for generations to come. The path forward is clear, but our actions, must be taken now. We know the effects, the impacts of climate change on our health. We know the impact of climate change on our planet, on our environment, on biodiversity. So now we need actions. We need to put these solutions in place for us to safeguard our economies in the coming years so that the prediction we have for 2050 would not happen if we work now. So in conclusion, I would like to reiterate on what SM Kadri said. He said, the health of our planet and the health of its people are two sides of the same coin. So climate change is not merely an environmental issue, it's a global emergency. And the time for us health professionals, for our governments, and for our community is now. We must work together to find and implement sustainable solutions that protect human health and ensure a livable future for us all. Thank you very much, Help People Help Themselves organization, for having me. And I hope this discussion was really insightful. Are there any questions for me? If we have any questions or anything to add, I think now is the time to do so. Okay, I can see a question here. What are some recent measures that were implemented and were proven to be effective against adverse health effects related to climate change? And how are outbreaks connected to food insecurity? Okay, so I'm going to start from the second question before we're going to the first question. Okay, climate change and disasters and disaster outbreaks, they are connected to food security because they affect our land, they affect our farmland. Like I said, during the Holocene period, we could predict the rains and then the dry season. So we could predict our cropping and our harvest. But now in the Anthropocene period that we are right now, that our activities are affecting our environment, we have shorter period of time between planting and harvest. And what happens in that time? We don't have good food. We don't get to harvest rich food, rich in nutrients food, or good food. We don't get to do that. The disasters affect, like the wildfires, they've destroyed farmlands. Farmlands that were once fertile, now they're no longer fertile because of the wildfires that have destroyed the farmland and has altered the richness, the nutrients of our farmlands. Also, our industrial activities has affected our farmlands as well. We exploit our land so much that we have little good lands left for agricultural practices. And these also affect the security of our food because chemical fertilizers and methanes, all these things affect our soil. And at the end of the day, we're harvesting foods that has been altered, that has toxins in them. So these are some of the ways these outbreaks can also affect the security of our food.
Yes, there's another question that I would like to ask. Given the increasing frequency of the extreme weather events, how do you foresee or see the long-term public health implications on the vulnerable populations, like the low-income and under-resourced area? Do they eventually just have to migrate, or is there more to it?
Yes, when entire communities are being affected by climate change, and when a community is no longer sustainable to live, it's no longer habitable, people tend to migrate from that community. And that is why we need solutions in place to mitigate the impacts of climate change on our environment. Because, for example, if a hurricane happens and we don't have a plan B, or we don't have a solution, we don't have any means of, getting back our community after the hurricane, we don't have means of saving lives, we don't have means of saving our infrastructure or of saving our lands, we tend to migrate after the destruction of that environment, after the community. So I think that is the worst that would happen when an environment has been depleted by natural disaster. And where do we migrate to? The more we migrate to other communities, we cause a population burden in another community. So this is the reason why we need climate change impact on our health is a crisis that we need to address now. We need solutions now to be able to predict, what happens in the future, predict disasters to come, diseases to come. That's why we talked about the EWAS tools. And now also we have AI that we can use in predicting what's to come, and also to make plans in place, policies in place to mitigate these disasters from happening.
Yes, thank you for that. So we have also received another question. It says that, how do we bridge the gap in addressing the climate change issues between the wealthy countries and the still poorly developed countries? As you spoke regarding Bangladesh, which seems to get the most affected because it is a poor and an underdeveloped country. So how do you bridge that gap? And because of the unequal contributions to carbon emissions, how do you address that climate change related health disparities? And how do you bring it forth?
Okay, the second question is, can you come again with the second one?
Yes. The second question that I have received is, since especially there's a disparity in the amount of carbon emissions and different kind of pollutants that are released by wealthy countries in comparison to low developed countries. And you gave an example about Bangladesh and low developed countries, which will be highly affected by the rising sea levels. And so, how do you bridge that gap and address the climate change issues between the both different types of countries?
Okay. Um, can you hear me? Am I muted? Okay. So, when it comes to carbon emissions, this comes from industrialization, which are not so much in low income countries or developing countries, because developing countries contribute less than 10% to this crisis we're talking about. But industrialization is going on, development is going on all around the world. Our resources are being, exploited. I would use that word, exploited. But we get our resources from our environment. Our medicines are from our farmlands. We get our oil from our floor. Our resources, our metals, and all these things are from our environment. So as we continue to exploit our environment for these resources, it aggravates the impacts of climate change on that particular community. And now most of these resources are found in the low income communities. Most of these resources are exploited from low income communities, and that is why low income communities face the most impact, yet they contribute they contribute very little towards these climate change disasters.
Yes, thank you for that.
Mm.
There is another question that I would like to ask that I have received. That is, as most of us that are involved are healthcare professionals, how do we be ready for the large amount of migrations that might occur due to these climate changes? How do we be better prepared for it?
Okay. When it comes to migration, we need to avoid these kinds of migration due to climate change. We need to avoid it because you're leaving your community, like I said earlier, to another community. You're going to overburden that community. You're also going to overburden that resources and deplete that community as well. What we need to do is to work on our own environments. We should put up infrastructures in place to help us manage the climatic disasters that we may face. So understanding the kind of climate change disaster that could happen in one community, because it differs from one community to another. So, and that's a different discussion, I think, because it differs from one community to another. It differs from one tropical regions to temperate regions. It just differs from the north, from the south, from tropical regions, temperate regions, from Africa, Europe, Asia. We all face different kinds of climatic disasters. So it's left for you to understand and predict what's to come in your community. That's where we come in as health professionals. What's to come in your community, and we set up solutions in place to mitigate it, so we don't have to migrate at every little disaster.
Yes, thank you for that. So we have had another question. It is the vector-borne diseases such as malaria, dengue, chikungunya are shifting to higher altitudes and then the lower altitudes. And what is the correlation between them? like the altitude difference and all?
They're not shifting, they're spreading because the temperature is increasing. We're experiencing increase in our temperature. So areas that were once cold are getting warmer. And these kinds of diseases like malaria and dengue fever, they thrive in tropical areas. They thrive in warmer areas. So that is why we see now that they tend to move from Africa to Southern America because of the change in our temperature. That is why.
Yes, that's all the questions we have received now.
Okay.
So we would like to end the session now. Thank you very much, Dr. Eloho, for
Very much for having me.
yeah. So if nobody has any other questions, we would like to end the session. And I'd just like to add, this is just a part 2 of the webinar series that we have started, and there are more upcoming webinars, and I hope you'll be tuned in to attend all of those webinars. Thank you very much, Dr. Thank you, Dr. Eloho.
Thank you very much for having me.